You can.
So I'll introduce myself. My name is Ellen Hughes. I am the clinical lead with the Holderness Primary Care Network at Rosedale in Heddon. Started the same day as my colleague Romy. We both started in May 2024 in each of our PCNs, and I think that's been quite helpful. But when we first came into the PCNs, we sort of really closely looked at what the model is and what is expected of the PCNs, what the role is across the community, across our local community. And we really put some thought into that about what it is we need to be doing and how can we take that forward and develop it. So the things that we looked at was the PCN is about working together with the community. So you've got your mental health teams, you've got your GPs, you've got your voluntary services, you've got all your other community teams. So things like your district nurses, you've got your Macmillan nurses, your local hospitals. So it's about bridging the gap with all of those services and us all working in a more integrated way. In terms of taking it forward, we saw a really good opportunity here to try and develop our local area, our local community across Holderness and Beverley. And we thought, what can we do to take it forward? What can we do to use all of those things? What could we do to improve what we've already got? And we sort of come to the conclusion we're going to have to change things and not continue to work in the same way. We need to think of it outside of the box. We need to think of some new ideas, come out of our comfort zone and see if we can work in a different way, because there's a lot of resources in all of those teams that I've just mentioned, but they all work very separately. Traditionally, we've all worked very separately. So by us all coming together and working in a different way, we sort of felt that we could improve the healthcare, it would be more effective, it would be better experiences for patients and for staff, and we're using the resources that in a better way that are already there. So that's sort of where we started from. We felt as though we needed a new vision for the teams and how could we take that forward. So we felt as though the main way we could do this is to work on those relationships with other teams and to work in a more integrated way. Started off within our own teams, getting our own team and staff involved with that and looking at what's already been done in the past, what ideas they had, what ideas we could come together as a team to discuss and look at and to consider, and to try things that we've not tried before. So that's sort of how we started with it. So what I first did at Rosedale is I contacted the GP surgery. So a big part of the PCN model is bridging the gap between the GPs and mental health services. So I contacted the manager at the Holderness Health Surgery, and one of the things that I've noticed is, you see, we've got all these teams are working separately, but they're all in their own buildings. Nobody comes together, and I just thought we've got a beautiful building at Rosedale that I feel really proud of, and I just thought open that up to all these other teams that are in our area, in Holderness area. So I arranged a face-to-face appointment visit for everybody from the surgery to come. It's not been done before, but I felt it was like the first step to sort of working in a more integrated way, and it went down really well. We actually got quite a lot of people from the surgery came. They was really interested to have a look around the building to see what we did and to meet everybody. So it went so well that we do that all the time now. So every 6 weeks, everybody across our patch comes to Rosedale and we have a face-to-face meeting, and that's really helped with everybody getting to know each other, building up their networks, building up the relationships. And we've got to the point now to take it forward even further, is to invite other sort of partners across the PCN. So we've got Mind coming now. I've spoken to Andy's Man Club. So if we can get all the services involved, I think that's where we could take that bit of it further. We also sort of considered how we can improve. So that was the proactive care team and the surgery manager that we have the meeting with every 6 weeks. And with the GPs, what we thought would be really helpful was to meet with them and the clinical director for the PCN right at the beginning and just discuss with them about our vision about it being more integrated and to get their views on it and to see what they think about that way of working and if they got any ideas. And this is what we've been talking about. How can we come together and make this work? So I had the first meeting in October 2024, and that was with the clinical director for the Holderness PCN and also one of the GPs at Holderness Health, who's like the mental health link. And it was a real success. It went down very well. I felt as though it was just good that Humber was getting involved and was showing that enthusiasm. So what came out of that, the ideas that came out of that was to set up a mental health triage clinic within the GP surgeries. So it suggested that we do 1 day a week at the surgery. The GP we'd have 1 hour slots, would have 4 1-hour slots, which the surgery would manage and the GPs could book into. And then I would go on the Friday. Any people that the GP saw in that week or the week before that have got a mental health issue, but they're not quite sure which service it needs to go to, or it's a little bit too complex, or they're just wanting some advice on something, they could book that patient in for a triage appointment. So we've got that going, but also because you're actually in the surgery, you feel part of the team. You're talking to the doctors. You're there to offer advice. They've often like got questions about what they need to do or some advice on certain situations, and they're not quite sure which team to send it to, or they're not quite sure what to do, or they've had some issues and they needed to raise concerns, but they've got nobody to take it to. They're not sure how to take it to. So we've done all of that, which I'll come on to the feedback sort of towards the end of this discussion, but we've had some brilliant feedback on that. And the other thing that it's really helped with from our point of view is if we've got anybody who's got any physical health queries or have got any concerns, before you'd have to ring the surgery and wait on the line for like an hour or so, and it was really difficult to get in there. You didn't have that time. You'd end up putting the call down, or you'd be emailing people. It'd take days for them to come back. Whereas now, because we know each other and we do feel like we're an extended team, I know I can just Teams call one of the GPs, or I can Teams call the manager or the proactive care team, and I've got an instant response. They do always come back, and it works both ways. So the GPs will call us, they'll Teams call, or they'll send a quick message or a chat or something on Teams, and we can respond really quickly. So that's been a huge improvement. So what's been helpful about this all being set up? So it's well established now as in Holderness is the GP clinic. We do it every Friday. It's well established. It's going really well. We've got some really good feedback. As I say, I'll go through all of that. But what's also been helpful is to identify obstacles of us working separately like we used to. So the things like the ERS is a really good example, I think, the electronic system. So GPs, I know there's been issues, and there continues to be in some teams, where GPs will put referrals into mental health services through ERS, and it'll come through to the team, and they'll think, well, that's not appropriate, or we haven't got enough information, and it gets bounced around. So you've got a patient here who's being bounced around services. So what I noticed when I first started working with the GPs was I asked to have a look at their system from their end. So we see it at our end, but nobody's ever seen it from their end. So they actually showed me what it looks like from their end, and they've got like 30 different options. So you can understand why the people are going to the wrong teams initially, or they're being bounced around. You can understand it, but we wouldn't have known that if we weren't working with them this way. So other things like understanding what each team's role is, understanding what their resources are, understanding what their limitations are, You had issues with like poor communication, like I've just been saying about the ERS, and you'd be sat in MDTs and people are getting frustrated at the wrong referrals and that sort of thing. So poor communication, not really knowing who it is who you're talking to in the other teams in the surgery, or them talking to us. Also, we found that it puts a lot of restriction on resources across the local area by us all working very separately. It's yeah, you've all got your little part, and a lot of things we're doing separately, and it's the same thing. So why not come together? So we've learned a lot, a huge amount of how each team works, what they've got to offer, and how we can use more effectively what our joint resources are. Um, so the benefits. So this is a big. So the benefits is, I think definitely in my team in Holderness, the team seem really happy. They feel as though the team has been really developed over the last 18 months. They feel as though we're going in the right direction. Um, we are working with the partners across Holderness in a more integrated way, which has been, as I say, it's been really beneficial. The communication across all the partners in the Holderness neighbourhood teams has massively improved. Um, we're able to access GPs if we've got any questions about physical health, if we've got any safeguarding queries or anything like that, we can quite easily get the GPs involved with that now. So meetings and things. So we're working more. It's more of an MDT. It's more of we see it. We've actually talked about it and got some really good feedback, but it's more of an MDT way of working. It's an extended team. We don't see each other anymore as being like separate teams. We're all in it for one reason, which is to get to provide the best care that we can across Holderness. And we're all signed up to that, and we're all working towards that. So we actually feel like we're a team. We don't feel like we're separate anymore, which is brilliant. Um, really good understanding now of each other's roles, what goes on in the surgery. They understand mental health services. I think it's always been talked about the building and coming into Rosedale. It's never been done before. You've never had GPs come and have a look around the offices or where the mental health teams are working. So by getting people in, we're welcoming, but also we're getting to know each other. You're talking to people who you've actually met. You feel as though you could approach them if there's any issues or there's anything you need to raise, and all of those things are happening. Um, so what we've noticed as well, there's been certainly in Holderness, we've had a huge reduction in inappropriate referrals coming into the team. We can evidence that through I know the trust collects the referral data. So there's been a huge reduction in the amount of referrals. When I first came to the team was overwhelmed with referrals. There just wasn't the capacity for people to be able to pick them up. The amount that was coming through and the amount of staff we've got it just wasn't working at all. So we've managed to massively reduce um, the inappropriate referrals coming through. From doing the triage clinic and trying to manage the referrals better, we've sort of developed that a bit further as well. So I now have a weekly meeting with the proactive care team manager. So any referrals that probably would have come through to us anyway, because they weren't quite sure, we now have a meeting on a Friday afternoon after the clinic, and we go through all of those. A lot of them can go to like talking therapies, they can go to mind. We're signposting them out, and it's not just about, oh right, they're going there, we all know each other. We all know very well now how each of the teams work, what they offer, what they've got available. And when we come together at the 6 weekly meeting, we can talk about these things as well. So if somebody wasn't quite appropriate, this is so we're starting that. So it's had a huge benefit to our referrals. Patients are getting to the right teams a lot quicker. They're not being passed around, so they're coming into services and they're very quickly being allocated to the right teams. So we've had some really good feedback around that. People have been passed around to different teams over the last year or so, they either come to the triage clinic or into the PCN, and the way that we're working, we're not just sort of right, okay, we haven't got strict criteria, which is what's always been the case. We're working in a real flexible, different way of working, and we're sort of looking what can we do rather than where can we pass this to. So we're working with that approach, and again, the feedback and the experience of the patients has been brilliant. We've very likely, I don't know, we've reduced referrals to secondary care, the need for people to go to the CMHT. So, and also we've reduced a lot of crisis referrals as well, because we've been able to, the GPs have been able to, they've seen somebody in the surgery, and probably by the Friday they're in to see us, or the following Friday, and we've been able to pick that person up really quickly because we don't have a waiting list. We've been able to put a plan in place, and we've been able to de-escalate anybody's mental health sort of deteriorating. And I think a lot of people I've spoken to, the GP, before this was in place, the GPs would refer somebody through to EdTap for assessment. They would then go on a waiting list for about 4 or 5 months. And whilst they're on that waiting list, people are escalating, the problems are becoming worse, they're not getting the support in time. Whereas the way we're working, we're reducing the referrals the GPs are having to put through to MTAP, but we're also reducing the need for referrals to go through to secondary care and crisis. We're able to deal with it quite quickly. We've got a nurse prescriber in the team, so that's been really helpful in terms of this as well. So we've been able to get people seen a lot quicker. So I've mentioned before, we've been able to speak to GPs a lot quicker. We've started to extend the partnership. So we do have a monthly board meeting across our PCN. You've got the GPs have traditionally organised that, and they invite all the other members and the other partners. So we've got people like mine, CHCP, you've got district nurses, you've got public health, ICB, Macmillan, and there's loads more. And it's usually organised through the GP, but we're looking at changing that as well. We feel as though this is the GPs and sort of our team feel as though it's been a real success what we've brought in. So we're looking at working with all these other agencies and partners that do get invited to these monthly meetings through the GP, but us all taking an equal role in that. So we're all going to be, we're just doing a bit of a project at the minute to see how we can improve this, and us all taking equal part. So it's not just up to the GPs to invite who they know, it's all of us taking a lead role in it. Yeah, communication's massively improved across all of the services. That's GPs, Mind, just yeah, ICB. They come to the board meetings. They've given really good feedback. Yeah. So what I was going to do next is I was just going to share some of the feedbacks from me. First one. So this has come from Dr. Surgery. So on this PCN, we've been offering direct bookable appointments since October last year, being able to offer them at both Head and Withensea, which are our main sites. This has been an invaluable service to our patients. The main benefits from a GP perspective are to be able to book a face-to-face appointment for the patient at the time we are seeing them. This helps reassure patients who are often anxious that they have an appointment pending at a local site that they are familiar with. It's also helpful for the GPs to be able to book patients into an experience in with an experienced clinician where their systems are a bit more complex. GPs have only 10 minutes for the consultations, and within this have very limited time constraints for it to be helpful. So to offer an appointment with Ellen, who can escalate up to the CMHT or the crisis or to the emotional wellbeing service, is much more appropriate. Excellent working relationship with our social prescribing team and also the GPs. This means we can liaise directly with PCN and vice versa regarding complex situations and any safeguarding concerns which are often more prevalent in the deprived community. So this next one is from the CEO of Holderness. So and this is also being sent to the ICB. So clinical lead for Holderness PCN, doing a great job. She now does a session in the practice every week, how clinicians can book patients directly into the slots. She meets and triages patients who fall between the normal referral pathways for mental health and ensures that they are appropriately directed to the right place. The Holderness Partnership Board meeting, which we'd attended the day before, also gave great feedback on how this is working. It allows our clinicians to do something with patients who would otherwise be stuck in the system, and it has allowed Ellen to feel part of the team, PCN to feel part of our team, and staff known by the staff. Integrated working at its simplest and finest. And then we've got another one. So this is from the head of projects and performance at Holderness Health. It's been so beneficial for patients having Ellen PCN spend regular time in the practice. It's helped embedded to staff a feeling she is part of the team and approachable for any patient concerns. The team, PCN and GP surgery, have formed a close working relationship with the proactive care team at the practice and work well together to achieve the best outcomes for the patients. Patients who are discussed and triaged, if they're not right for the PCN, then they will be swiftly signposted to the appropriate team. Having a regular scheduled presence has helped staff know when Ellen's around and available for any advice around patient and mental health support. So we've had some really good feedback as well. I'll just quickly pick bits out of this. So this feedback's come from the clinical director for the Holderness PCN. So she's put in here, the ability to book in directly has meant that patients who normally find it difficult to engage have engaged, as we are able to give them an appointment time there and then. This has allowed us to arrange prompt assessment for patients who present with escalating symptoms but do not meet the threshold for the crisis intervention team. So allowing the de-escalation at an early stage and an alternative pathway of care. In contrast to many other referral pathways, the process from a clinician perspective and working with this triage clinic is straightforward and easy accessible. Reached out to the wider team and provided support and advice to the proactive care team, enabling sharing of skills and knowledge and ensuring that we get patients in the right place on a first time round, reducing the challenge of navigating the system. This has also allowed primary care team to discuss directly with the GPs any physical health or medical issues that we need to act on more quickly. Overall, it is a fantastic example of collaborative and neighbourhood working, and we strongly support its continuation and development. It's so positive, isn't it? It's just brilliant. So that's some of the feedback. So what we were going to sort of do from now on was try and capture some of the data as well, so we can, everybody's saying it's wonderful and it's working well and we all feel it has been a huge success, but it's actually capturing that data. So we had a meeting with Catherine had given us some really good suggestions on how we do that. So the next step from my point of view was I've spoken to the project manager at the surgery, and they've not sort of captured data as such, like how many we've had in and that sort of thing. But what they are going to look at doing is getting feedback from the patients and collecting that data and getting feedback from the staff, the surgery staff as well. So in going forward, so I've been thinking about it going forward. So we've made a real success of this across Holderness and Beverley, and we've tried it in both areas. It's where we go forward and how we develop it. So we feel as though we're a bit ahead of the game with the NHS 10-year plan that's recently come out. So if you look at the focus for that plan, the key shift in this is neighbourhood healthcare services, integrated care that is not detached from our communities. So we feel as though what we've already started to achieve, or what we've already done, is very much within that 10-year plan, and we need to take it forward further. So the sort of things we're looking at is continue the 6 weekly meeting we have at Holderness is to continue to open that up to other partners across the Holderness area. So like more of the partners that go to the board meeting that they have at the surgery, maybe get them to come to us as well. So we're getting more of the partners are coming into the building, they're getting to know the staff and the services. We would also be looking at being more involved in the local community. So that would be attending like events that they've got going on, healthcare events. I know the surgery's just started a few months ago to have open days at the surgery, and they've got the staff working on the Saturday. So messages go out to all of the patients across the area, inviting them to come and have a look around and see what they do, meet the staff. So we thought that's something, an opportunity for us at the PCN, we could get involved with that. So Humber's actually been represented in these open days. Talking to the patients, getting them more involved in discussing what we've done, how we're currently doing these clinics, how can we get their ideas as well in going forward, seeing what the patients experience, talking about them, about their experience of it working this way. Have they got any suggestions about how we can improve it? That would be something we'd want to do. So I've talked about collecting the data from the surgery, but just developing that sense of everybody being involved, everybody working in an integrated way, and all playing a part in that, so that we can really pull everything together to get the best healthcare we can for across our patch in our local community. I think we've sort of, I think the issues that we had when we first came into the team, when we have our weekly sit rep meeting, we discuss issues across the teams and the good work as well. We have the leadership meetings, and I think Romy and myself, we've been taking what we're doing to those meetings, and we're getting some good feedback from there as well. And people sort of say, well, actually, we could work in that way. That might help our team. So it's looking at how we can get it across the full East Riding PCNs and working in that way. Yeah, as I say, it fits in with a 10-year plan. So if we can work in that way, I think overall we've found that it's just been a huge success. It's better for the patients, it's better for the staff, it's using the resources in more effectively. And we've actually been able to achieve this without asking for any extra resources. We've not asked for any extra funding or anything. It was always, right, this is what we've got. Let's make sure we know exactly what we have got across the full area. How do we make it work with what we've got? Obviously, I'm sure we could use extra money, but we've been able to. I think we've proven the point that just keeping throwing money at everything isn't always necessary. It's about how are we going to work in a different way? Think outside the box, do it in a different way, and use what we've already got in a better way, and it's worked brilliantly.